Nicotine replacement therapy. Nicotine replacement therapy works by replacing some of the nicotine smokers get from cigarettes to reduce the uncomfortable feeling after quitting. Nicotine replacement therapy supplies nicotine to the brain without hundreds of harmful chemicals cigarette smoking contains. Nicotine replacement therapy helps smokers lessen the uncomfortable feelings that come after they stop getting the nicotine from cigarettes. Nicotine replacement therapy are available in the form of patches, gums, lozenges, sprays, and inhalers. People with a severe nicotine dependence should consider nicotine replacement therapy to help them quit smoking. These include people who smoke more than 1 pack a day, who smoke within 5 minutes waking up, who smoke even while sick, who wake up at night to smoke, and who smoke to ease the symptoms of withdrawal. It is best to discuss nicotine replacement therapy with your healthcare provider before starting it to decide on either to use or not to use nicotine replacement therapy. The benefits of quitting tobacco must outweigh the health risks of using nicotine replacement therapy. Nicotine replacement therapy are relatively safe for all adults who want to quit smoking, except pregnant women and teens. Nicotine replacement therapy should not be used by people who are currently smoking or using any form of tobacco. Number 1. Nicotine patches. Patches give measured dose of nicotine through the skin. Many different types and strengths of patches are available, including 16-hour and 24-hour patches. The type and strength of patches to be used depends on how many cigarettes you smoke each day. How to use nicotine patches depends on body size and smoking habits. Full strength patch 15 to 22 mg should be started daily for several weeks, then switch to the weaker patch 5 to 14 mg for another several weeks. The patch should be changed every day. It should be put on in the morning on a clean, dry area of the skin with less air, for instance the arm or the chest. Number 2. Nicotine gum. Nicotine gum is a form of fast-acting replacement. It is taken in through the mucous membrane of the mouth. It is available 2 mg and 4 mg strength. Nicotine gum should be chewed slowly until you feel a tingle or peppery taste. Then tuck the gum inside your cheek until the taste disappears. Repeat the process for at least 20 to 30 minutes. It is important not to eat or drink 15 minutes before and during chewing the gum, because some food may affect absorption of the nicotine. Chew no more than 24 pieces of gum in one day. Nicotine gum is recommended for 6 to 12 weeks, with maximum being 6 months. Number 3. Nicotine nasal spray. Nasal spray delivers the nicotine rapidly to the bloodstream because it is absorbed through the nose. While using nasal spray for the first time, 1 to 2 doses per hour is recommended. 1 dose is equals to 2 sprays, 1 in each nostril. At least 8 doses may be needed each day, and you should not exceed more than 40 doses each day. Number 4. Nicotine inhaler. The nicotine inhaler is a thin plastic tube with a nicotine cartridge inside. They are the Food and Drug Administration approved nicotine replacement method that is most like smoking cigarettes. Nicotine inhalers are the most expensive form of nicotine replacement therapy available. On how to use nicotine inhaler: puff on the inhaler and the cartridge sends a pure nicotine vapor into your mouth. You may use up the cartridge all at once over about 20 minutes or puffs it only a few minutes at a time. The recommended dose is between 4 to 20 cartridges, slowly tapering up over 6 months. Number 5. Nicotine lozenges. Nicotine lozenges is available in 2 mg and 4 mg strengths. The dose depends on how long it takes you to have your first cigarette after waking up. If you smoke your first cigarette within 30 minutes of waking up, use 4 mg nicotine lozenges. If you smoke your first cigarettes more than 30 minutes after waking up, use 2 mg nicotine lozenges. It is recommended not to eat or drink at least 15 minutes before using a lozenge or while using a lozenge. Some drinks can reduce how well the lozenge works. Not use more than one lozenge at a time, and do not use one right after another. Suck on the lozenge until it is fully dissolved, about 20 to 30 minutes. Move it from side to side in your mouth. Do not bite or chew it like a hard candy, and don't swallow it. The nicotine absorbs through the mucous membrane of the mouth. Do not use more than 5 lozenges in 6 hours or more than 20 lozenges per day. Stop using the lozenge after 12 weeks. If you still need to use the lozenge, talk to your doctor. For nicotine patches, the side effects include skin irritation, dizziness, sleep problems or unusual dreams, headache, nausea, muscle aches and stiffness. For nicotine gum, the side effects include bad taste, throat irritation, mouth sores, jaw discomfort, nausea, hiccups, tachycardia. For nicotine nasal spray, the side effects include nasal irritation, runny nose, watery eyes, throat irritation, sneezing, coughing, headache. For nicotine inhalers, the side effects include mouth and or throat irritation, coughing, stomach upset, runny nose, headache, tachycardia. For nicotine lozenges, the side effects include sore throat, hiccups, coughing, headache, heartburn, gas, trouble sleeping.